Semaglutide, Ozempic, revolutionize your diabetes and weight loss journey. Are you tired of the constant battle with weight gain due to your diabetes medications? Finding it tough to keep your blood glucose levels in check? What if we told you there's a game-changing solution that could turn things around? Get ready to be amazed. In today's video, we'll unveil the revolutionary treatment, Semaglutide, which not only combats weight loss struggles in diabetic patients but also enhances diabetes management. Stay tuned, and let's uncover the secrets of Semaglutide that can make your worries a thing of the past. Semaglutide, mechanism of action and benefits. Wondering what makes Semaglutide so special? It's all in the way it works. By latching onto GLP-1 receptors, this remarkable medication triggers insulin release and puts the brakes on glucagon secretion, paving the way for stable blood sugar levels. But that's not all. Semaglutide goes the extra mile by slowing down gastric emptying, keeping hunger pangs at bay, and propelling you towards your weight loss goals. Intrigued by Semaglutide's impressive benefits? Stick around as we delve deeper into this amazing drug that's transforming the lives of diabetic patients. Dosing. Embarking on your Semaglutide journey involves finding the perfect dosage to suit your individual needs. To kick things off, patients usually start with a modest dose of 0.25 mg once a week. This allows your body to become acquainted with the medication. As time goes on, and under the careful supervision of your healthcare provider, the dose may be gradually increased. This step-by-step approach ensures a smooth transition towards the maximum dose of 2.4 mg once weekly if needed. By personalizing the dosing regimen, you can experience the full benefits of Semaglutide, while taking into account your unique requirements and tolerability. Keep in mind that it's essential to work closely with your healthcare provider, who will help you determine the most appropriate dosage for your situation. Administration. When it comes to administering Semaglutide, the process is straightforward and easy to learn. This wonder drug is delivered via a subcutaneous injection, which means it's injected just beneath the skin's surface. By targeting areas such as the thigh, upper arm, or abdomen, you can ensure a smooth and comfortable experience. If you're new to self-injections, don't fret. Your healthcare provider will guide you through the process, teaching you the proper technique and injection site rotation. Remember, consistency is key. Administering Semaglutide at the same time each week will help you stay on track and maximize the medication's benefits. Adverse effects. As with any medication, Semaglutide may cause some side effects. It's essential to be aware of these potential adverse effects so that you can recognize and address them if they occur. The most commonly reported side effects are gastrointestinal in nature, including nausea, vomiting, diarrhea, and constipation. While these symptoms may be concerning at first, take comfort in knowing that they typically subside as your body adjusts to the medication. During this period of adjustment, there are steps you can take to alleviate any discomfort. Stay hydrated. Drinking plenty of water can help alleviate symptoms such as diarrhea and constipation. Eat smaller, more frequent meals. This can reduce the likelihood of nausea and vomiting, as well as ease digestion. Consult your healthcare provider. If side effects persist or become severe, reach out to your healthcare provider for guidance and potential adjustments to your treatment plan. Remember, everyone's experience with Semaglutide may differ, and some people may not encounter these side effects at all. Always keep an open line of communication with your healthcare provider, who can help you navigate any concerns and ensure your treatment journey remains safe and effective. Evidence from the published research. Let's delve into 3 major clinical studies that showcase the remarkable potential of this groundbreaking medication. The STEP trials, published in the New England Journal of Medicine, this series of clinical trials involved thousands of participants who received Semaglutide for varying durations. The results were astounding, with patients on Semaglutide losing an average of 15.3% of their body weight, compared to a mere 2.4% for those on a placebo. SUSTAIN 6 trial. In this study published in the New England Journal of Medicine, Semaglutide demonstrated its ability to improve glycemic control and reduce the risk of major cardiovascular events in diabetic patients. Participants who received semaglutide experienced a significant reduction in HbA1c levels and a lower risk of cardiovascular complications compared to the placebo group. Pioneer 4 trial, published in The Lancet Diabetes and Endocrinology, this study compared the effectiveness of semaglutide to other diabetes treatments, such as sitagliptin, over 52 weeks. The results revealed that patients receiving semaglutide experienced superior blood glucose control and a significantly greater reduction in body weight compared to those taking sitagliptin. These clinical studies highlight the profound impact of semaglutide on weight loss and diabetes management, offering a promising and effective treatment option for many patients. In conclusion, semaglutide is a game-changing solution for diabetic patients aiming to shed weight and take control of their blood sugar. Remember, always consult your healthcare provider before adjusting your treatment plan. Thanks for tuning in. Don't forget to like, share, and subscribe for more captivating and insightful content.